We are live this afternoon in Kinston, just outside Lenoir UNC Health Care, one of the many great hospitals across eastern North Carolina. This is our latest stop in our Hospital Heroes series, as we say thank you to the men and women on the front lines each and every day over the past 13 months fighting the coronavirus pandemic. Joining us now is a nurse here at Lenoir UNC, Jonathan Thigpen. Thank you for being with us.
Yes, sir.
Let's talk about what life has been like from, say, March last year to March of this year. I would assume it's been hectic, but hopefully there's light at the end of the tunnel.
Oh, yes. There's a dramatic change. The census in the last 3 weeks has dropped dramatically, and I hope it continues to do what it's doing.
You think that's because of the vaccinations that are kind of getting ramped up in our state?
I hope that's what it is. It appears to be. Yes, sir.
All right, let's talk about your day. I would assume it's hectic. Kind of lead us through a day in the life of a nurse inside the hospital here.
A hectic day. Well, you know, the first thing in the morning, we're trying to, these people here are isolated. We get in the rooms and we're trying to, make sure to get things done, get them up to the chair. Usually, some people are on oxygen and stuff. We're having to titrate their oxygen back and forth, and I mean, it could be,
It could be anything.
It could be, yeah.
At a moment's notice, it changes. Let's talk about the relationships you build with the patients and the families in a time where a lot of these patients and families are having to isolate because of COVID. You're there to maybe lend some support as well as medical attention.
That's right. We actually go in the rooms and do the FaceTiming with the families, so that way they can at least have a little bit of experience with them, because they are isolated. They do not get to see their family members. And that, believe it or not, it does have a 100% impact on the patient's well-being and emotional state.
What was the darkest time that you had to experience in here in the last year? Was it over the winter, just after Christmas?
Yeah, probably right after Christmas was probably the darkest time. I've seen the most people come in that had, had the most severity and, the most problems. Yes, sir.
And you mentioned the last 3 weeks, you kind of seen some reasons to be optimistic. So as we head towards the spring and the summer, what would you say to folks watching that are maybe hesitant to get that vaccine?
Why would they be hesitant?
Yeah.
I mean, I wouldn't see why you should be hesitant to get the vaccine. I mean, like I said, with the census dropping like this and vaccines have started along, I don't really see why you would be hesitant at all.
Let's talk about the community. I know Kinston's tight-knit. They love their sports here, but the community as a whole is very supportive. Have you seen that support from Kinston and Lenoir County throughout this? Yes,
sir, absolutely. Yeah, the community has been very supportive towards us.
That is great. We thank you for being here, Jonathan Thigpen, one of the nurses here at Lenoir UNC Health Care. Thanks for being with us, and thank you for you and all the staff for what you've done here in the past year.
All right, thank you.
We will continue here on our news at 5:30. Another employee here from Lenoir UNC Health Care will join me to talk more about what life is like during the pandemic.